Welcome to Uptown Studios Live. Happy Tuesday. It's going to be 91 today. Oh my gosh, it's going to be so hot. I am Tina Reynolds. I'm the founder of Uptown Studios, and I am here with the magical, mystical Mia Lopez.
Hello. Thanks for inviting me back on your show, Tina. I appreciate it.
You're always invited. Anytime you want to be on, you just let me know and I'll have you on. So today we're going to talk about social change, behavior change, and what it is that we do to create the campaigns that we work on all the time. And they're usually about behavior change or social change. Behavior change in the models that we utilize social marketing techniques, which is establishing where the people are. They're here. They don't know anything about it, never heard of it, don't know about it. And over here on this linear model, way over here, is I know about it, I have adjusted my behavior, and I maintain my behavior all the time. So let's talk about tobacco cessation. Over here is like, I'm a smoker, I don't know it's bad for me, I'm going to continue to smoke. Over here is, I used to be a smoker, I quit a long time ago, I will never ever smoke again. And in here in the center part, this is the place where we can affect behavior change with these tiny steps, tiny steps. It's like, okay, you see a message about quitting smoking and you go, yeah, I'm going to quit smoking someday. And then they see another message and another message and another message, and they say, I'll quit. And they quit. And they move along this linear model more towards this maintenance, and then they smoke again. So they take a back step. And then the message would be, you can do it. I know it's hard to quit, and you've probably smoked again, but try it again, because you never know when it's going to be effective and you're going to quit smoking. So that's the behavior change model. So we find out where people are in this issue that we're addressing with our campaigns, and we create a campaign around those center people where we're going to affect change. It's really hard to affect change with the people that haven't heard about it. I'm never going to change. It's like today we have an issue with anti-vaxxers. It's like, I'm not going to get vaccinated. I'm never going to get vaccinated. No, I will not. And then there's the people in the center that think, I need a little bit more time. I'm just not sure. And so we're going to give them the information that's going to help them to move closer to, yes, I will get the vaccination. And we apply this technique to almost all of the campaigns that we do work on. Yeah.
Right. And I mean, in the practice of, creating designs for social change and behavior change, it really is about identifying the smallest, easiest step that has the most effectiveness to help people create long-lasting change, right? So, for example, recycling. You have your habit of how you take out the garbage, you put it in cans. And so what is the smallest step that you can take to make sure that you get the right materials into the right cans? And it may seem like, oh, well, you just need to sort it. But it starts before there. It might be having a recycling inside your house versus garbage, so that they're already separate when you go to the cans outside. Yes. So it is thinking about all of those little tiny steps.
Right. And in the same instance for tobacco cessation, it is like we'll give them straws to chew on, or we'll give them an insert to put into their cigarette pack that says, remember, you're trying to quit, because you have, I think you have 3 seconds that you're going to light up or you're not going to light up. And so if we can stall them for 3 seconds, they might be able to get by that cigarette and not light it up. So we're figuring out all these little tips and tricks, and it's the same with recycling. It's like if you have a recycling bin and your recycling is always overflowing because you have so much recycling, that moment before you dump it into the can, maybe that's the moment that we add in a reminder to crush your cans and to cut up your boxes, right? So that you can pack more stuff in. So it's like we find out where that behavior change can slide in so that it is an easy behavior change. It's easy for you to adopt. And then you start doing it every time, right?
And It can get really scientific, but there's not always the time to get that scientific. There are definitely practices where the community-based social marketing is a class that Tina lets some of our team members take, and I've been through that course, and there is like a science to how you measure the change, measure the impact, and then decide what action to move forward with. And we don't always have the time or the resources in order to go that deep. So we want to share some of our steps today of how we can help our clients identify the actions, identify how we communicate those actions and those changes so that we are encouraging the community to make those changes and start making some behavior change.
Yes, absolutely.
And today, specifically, it really is about public safety today.
Yes.
We work on several...
It's all about public health, really, because of the COVID. So we've done a lot of public health messaging, and it's continuing because we went from wearing masks and 6 feet apart. And we're going to talk about a couple of the campaigns and how we got to our ultimate designs and pushed it out, push the messaging out.
Yes. And so our first, what we want to talk about first today is really like, how do you create that message? How do you find out what the community already knows, what they think about something? And sorry for the background noise.
Your dog is home. Hi, Wendell.
My dog is home.
Hi, Wendell.
He went to the vet this morning, but he's good. So we will be creating the message. We worked with the Placer Community Foundation back in 2020, and they identified the need to reach out to their Hispanic Latino community about wearing a mask, keeping distance, and how do we encourage that group to take the safety precautions for COVID-19 safety and to keep them safe against COVID.
Yes. So part of that was before we started on the Placer Community Foundation Mask Up, we worked on the census and Census 2020, and our task was to outreach to the hard to reach populations. And so it's all a learning experience. The experiences we learned through that project that lasted a little over 2 years helped us in defining Placer Community Foundation's work. And you could talk about how we define that, because it was a hard to reach population.
Well, what we did was the Placer County has their health department. They had the folks doing the outreach to the community for COVID. So we had the contact tracers that we spoke with, the health supervisors, and the folks in the field doing the work. And we actually had them fill out a survey, and we asked them various questions about what do they hear the community say when they're approached with COVID safety, taking precautions, what are some of the common misconceptions that they're hearing about in the community, so that we could identify where we need to target the messaging first.
That survey was to the supervisors and the health officials, not to the community. They had face-to-face and contact with the populations that we were trying to outreach. So they really were the informed source that we were seeking help from. And they were very generous with their time. They really helped us.
Yes, they really helped. And then we also had another survey out to some of the community-based organizations to also similar questions about what do you hear from your community? What are people saying? What are some misconceptions? How do we encourage people to take the safety precautions that they need to take? What we had moved forward with at that time, after we had heard back from everyone, we created a campaign called Mask Up Para Tu Gente. Okay. We're going to pull up the presentation so that you can see some of the artwork that we developed. But Mask Up Para Tu Gente is all mask up for my people. So it's a very, community oriented. It's not just for me. I'm not just masking it for me. I'm masking it for my friends, my family members, my grandparents, my siblings, my cousins, everyone. And so
the community, what we discovered in the community is it is all about family, and really closely knit families that are probably living in the same household with grandparents and grandchildren and children. And we heard that from the Placer community health people and all of the CBOs, that this is what the community wanted.
And so we developed a series of content. It really was about inspiring, motivating, showing like, hey, be the hero of your family. This is for everyone. And we created artwork in English and Spanish to help communicate, and in Spanglish to help communicate these messages. Mi gente es tu gente. My people are your people. We're all in this together. And then, of course, also modeling. So making sure that the ads and promotions modeled what the actions that we wanted the community to take.
Mm-hmm.
So secondly, the second part is all about how do we create that messaging for the target audience, and making it so that the communications, the artwork, it doesn't look stifled, it looks community oriented. It looks like the community that we're serving, and it looks like who we're talking to. And in this case, another, talking about COVID safety today, we worked with the city of Sacramento on a similar mask campaign, but this one was for more general, reaching out to all of the community members. The city of Sacramento, especially early on in the pandemic, they wanted to get out the message, wear your masks, keep your distance. Things were still new and unfolding. And so we weren't, it wasn't really clear, what do masks do for me? How do I take care of my masks? What about social distancing? What if I'm in these situations where I can't social distance? And so it was all about getting out messages so that people felt confident and knowing how to move forward.
And do we have images from that campaign?
We do, yes. Okay. So we ended up with a campaign, we heard them, we wanted to make it fun, really engaging, and we developed the Show the Love Sacramento campaign.
There it is. Yeah. So, and another thing with both of these campaigns, we wanted to use local people, people that were recognizable to each of the communities that we were outreaching to. And when we didn't have local people, we used stock photos, but we really wanted to make them appear to be local and fit into the whole theme of what it was that we were doing.
Mm-hmm.
So
go ahead, Tina.
No, yeah, real people. We wanted to use real people.
And we did. We asked community members and we got a ton of submissions. We reached out to our partners, our community partners, friends, family members, and we said, hey, y'all, we're doing this. We need to mask up, show everyone. And we asked our community to send us pictures in their masks, with the heart. And we received a ton of submissions. And so the actual artwork, what it all looked like community members. It was the Sacramento community sharing this message.
Yes. And then we would get notes back. This is my neighbor and her kids. I mean, we would get notes back from people going, oh, I saw myself on the billboard. Oh my gosh, I got it. My whole family is looking at it, right? Mm-hmm. So by using local people that are recognizable, it really starts conversations about, oh, I understand now. It's something that I'm going to look at. I'm really going to look at this campaign.
Right. And it's something that I see myself in. It's something that I want to share with others. Yes. And it's something, and it doesn't look government-y. We wanted to avoid it looking like a government message. The government's telling you what to do. It's like, no, this is a community effort. We're all in this together.
Yes, we're all in this together. And so we really pushed out all of our connections and got commitments from community members, and they sent us photos, and then we masked them out and made them fit into the campaign so that it had the look and the feel of the campaign, so that it was recognizable. And it was repetitive, so that we changed the colors on the backgrounds, but they were all bright and fun, and show the love, Sacramento. You can do it. Everybody's doing it. Get your mask on.
Yes, from Uptown Studios. Our team's on there. It was really, really fun gathering community involvement for this one. And anytime we develop a social change campaign like this, it is about getting our brand evangelists, our communicators, our leaders within the community to really take the message and run with it and share it with others.
Yeah, and most of the time it's leaders in the community, not government. Because in campaigns like this, there is a hesitancy to trust government. So we really wanted it to be neighbors and people that you knew, and people that looked like you, and people that you would recognize.
Mm-hmm. Yeah, great, awesome. So step one, creating the message. How do you find that information? We use surveys. We talk to community members. We talk to clients to understand what people know, what they don't know, what are the steps that people need to take, and how will we be able to affect change through marketing and messaging, social media, using partners, using graphics, using videos, all different avenues for communicating the message. Yeah. But that's just, we're communicating to our community. We're getting some people involved by them embracing the message that we're sharing. But there's also a third part to what we do when we create social change campaigns like this. And it really is about how do we creatively reach and engage the audience? So beyond the messaging and the social media posts, how do we get people to own it and jump on board? Well, and I didn't put the right pictures, now that I said that, Tina, into this presentation, but we will show you the Show the Love campaign, the Life Looks Good on You campaign.
Life Looks Good on You.
It's a campaign that we work with Sacramento County Regional Parks, and this we will be working on this year as well. So please, keep an eye out. But this is a really fun one. It's all about how do we get people, specifically young men, to wear their life jackets when they're swimming in the river. And
go back a little bit. In 2015, we were hired to do this campaign by Sacramento County Parks and Recreation because there were 16 drowning deaths in the rivers in 2015. So they knew that they had to do something because the drowning deaths were rising. And so we came up with this whole campaign, Life Looks Good on You. And it was about wearing these ugly orange life jackets and doing it with fun because we couldn't make them look sexy. So we had to make them look fun. Okay, Mia, I'll let you go now.
Well, yes. And so for a number of years, we partnered with the Sacramento soccer team.
Yes.
The Republic.
Sac Republic.
The Sacramento Republic. We also partnered with a number of college women's sports teams as well to have cool athletes, people you could look up to participating. And then we also had a presence at some of the Sacramento Republic games the last couple of years before COVID, where we handed out life jackets. We engaged with the audience. We actually had people take orange life jackets and they brought them home with them. And so that's the engaging part, right? We want people to actually pick up the life jackets so that the next time that they're at the river, they're thinking, oh, I should bring my life jacket. I know that this is something that these are precautions that I need to take.
Well, another thing that we did is that we went into Arden Fair Mall and asked all of the stores if we could put life jackets on the mannequins in their store windows. And it was for a prevention campaign. We gave them all the information about drowning deaths, and they could be an active participant in this awareness campaign that we were doing. And lo and behold, everyone said yes. Even Abercrombie and Fitch, they had our orange life jackets on all the mannequins, and the salespeople were wearing them in the stores. So it was this magical, and it didn't cost us a penny. It was just a matter of our time going in and asking the store managers if they would join us in this one-day event. And they did, and we got news media. It was really great.
Yeah, and everyone had fun with it. You know, the stores, the folks working in the stores had fun with it. We also had in the center of the mall, we had a nice big, the LED screen at Arden Fair Mall. It was full. It had Life Looks Good on You artwork on there, and we had an engagement booth in the middle of the mall. So as people walked around, they saw the life jackets, and they would come up to us and ask us, oh, what is this? What's going on? So now we're able to engage them in a conversation about the life jackets. They're interested. We've piqued their interest, and we are that much closer for them remembering the next time they go to the river, you know, oh, I can't forget my life jacket.
Yes, right.
And so it is, you know, again, community members. We went to the river. We asked people at the river, hey, we're doing this. Do you want to be part of it? And we had a lot of fun with these photo shoots and real Sacramento people.
Yes, real Sacramento people floating down the river and making these ugly orange life jackets look so cool. I think it's about the guns, the arms on this one, you know?
You know, they definitely look cool. They definitely look cool. Yeah, so those are our 3 examples for social campaigns.
Yeah, and behavior change and social change, behavior change, and behavior modification. It's all of that that's wrapped into the research that we do prior to the images. But the images are the magic part because that's what everybody sees. So if you get that research right and you get the images that reflect the research that we've discovered, then people are going to recognize it. They're going to recognize it. They're going to start to go, oh yeah, I should wear a life jacket. The rivers aren't safe.
And what's resulted on that campaign in particular, you know, we went from record number of drownings and we've reduced it 80%. So the significance of the efforts that the county has put towards through this campaign, through in-person presence in the rivers. I know they partner with a number of organizations. DART is one of them. They usually partner with to also engage people around life jackets. And so it really has been really, really successful and one of our favorites, one of my favorites.
It's a very fun campaign. We have about 7 minutes left. So let's get to this next part 2, designs for the community. This is some campaigns that we did for Sacramento City and the California Department of Public Health.
We already, that was step 2. Yeah, we rushed through that, Tina. So
you did. Okay. All right. Go. You go.
You want me to go? Okay.
Yeah, I don't know where we are.
We went through our agenda. So, Tina, tell me a little bit about why Designs for Social Change was something that you've been drawn to and have aimed to do for Uptown Studios.
So in 1993, I worked on a campaign called Teens Stopping AIDS, and it was a $3 million $3 million project to reduce unsafe sex practices for teenagers. So in 93, a teen, if they wanted to use a condom, had to go to the pharmacy and ask the pharmacist to purchase a condom. They weren't out on the shelves. So as you can well guess, that teens did not use condoms because they were too hard to get. So we started this Teen Stopping AIDS project, and it was all about social marketing. It was about research. What is it that teens need? Where are the high-risk zip codes? So we identified high-risk zip codes where there were more teen pregnancies, STDs, STIs, and the like. And we distributed 30,000 condoms in Sacramento. I was known as the condom lady which was a really fun tag for me. So I started with this social marketing, and we had 3 years of in-depth experience with social marketing and training. And I embraced it because creating for social change is really doing something good for your community. It's not just about making money for a company. It's not just about selling products and pushing widgets out there. It's not about your bottom line, your sales figures. It is about building a healthier community that surrounds you, that everybody around you. So because I embraced that, it was every time I hired an employee, we talked about social change and behavior change. And I sent employees to the same training on social marketing that I attended. You attended that training, Mia, and several others of our team. And then in 2013, human-centered design hit my radar. And I got trained in human-centered design, and then I brought in some experts, and they trained our team on human-centered design. And human-centered design is similar to social marketing, with a little bit of a different emphasis on creating empathy with the target audience, so that you go in to your focus groups and you really are bringing big ears and asking the right questions, so that the audience is telling us what we need to do to create a solution for the issue that they have on any particular issue. So they tell us what they need, and then we create around what they need, not our solutions. It's their solutions to the problems. And so the tagline Designs for Social Change really started in '93 when I started this prevention marketing initiative. And it is a rock solid tagline because it's what we're all about. We apply all of these techniques whether you're a corporation or not. I mean, you can be a company that's selling widgets and making money. That's an okay thing. We agree with that. That's a good thing. But we apply all of these same techniques to your marketing, so that when you're rolling out a new product, we're really looking at, okay, so your target audience is 21 to 35-year-olds, and mainly it's women. And what are the zip codes, and what are the people doing when they use your product? And we figure it out from there. So that's why social marketing, behavior change, human-centered design, designs for social change, this is all so important to me because we really are creating a better world.
Is there anything that, from when you started social change in '93 to the way we now manage and work on these campaigns, what's changed and what have you learned?
Well, let's see. We had fax machines back then, and yellow page ads, and ads in the B, and billboards, and radio and TV. And so a campaign was really expensive. So today we can do all of that work on probably 1/20th of the budget that we had back in the early '90s when there wasn't these opportunities. So we can create videos, we can do social media ads. It is like the world is open and it's affordable. So, and we know that people are on Facebook. We know that people are on TikTok and Twitter, and we know where they are. If it's a particular audience, we can identify what channel that they're on. And we can recommend that we spend our money on this channel, but we advertise lightly on these other channels, right? So everything is different. The amount of time it takes from beginning to end of a campaign has compressed. I mean, the amount of time in the '90s was this long to create a campaign. Today, it's this long to create a campaign, and it's better and more robust, and it's going to hit more people, and you can track it. You couldn't track it before. I mean, you could hope to track it, but now you can really track it.
Awesome. Well, I mean, I know that they really are fun, awesome campaigns to work on, and it feels good to be able to feel like we're helping our community.
Yeah, it really does. It really feels like we're helping and making a change. I like to tell people that for everybody that works at Uptown Studios, we actually feel like we have saved a life. Somewhere in one of the campaigns, each of our team feels like I actually saved somebody. I don't know who they are, but I believe that I saved a life in this campaign no matter what it is, which is a great feeling. We're always doing something good.
Yeah.
And we showing up.
Absolutely.
And it's thank you, Mia, for joining me and pulling all this together and helping to talk about what it is that we do. We love what we do. We want to do more and more. If you have any questions on your campaigns, you can always reach out to us, Tina@uptownstudios.net or Mia@uptownstudios.net. And thank you so much for joining us today. And we will see you next Tuesday.
Thanks,
everybody.
you.
Bye-bye.
Try to avoid